What if I told you that the decisions you make today could determine whether or not you'll need glaucoma surgery down the road? It might sound dramatic, but the truth is, there are 7 common mistakes that can significantly increase your risk of needing surgery to treat glaucoma. Glaucoma is one of the leading causes of irreversible blindness, especially as we age, and the scariest part is, most people don't even know they're at risk until it's too late. But here's the good news. By understanding and avoiding these 7 mistakes, you can take control of your eye health and protect your vision for years to come. In this video, we'll break down these crucial mistakes, reveal the science behind them, and show you how to make simple changes to avoid surgery altogether. Stick around, because the knowledge you gain today could save your sight tomorrow. Glaucoma refers to a group of eye conditions that damage the optic nerve, often due to increased pressure inside the eye. This pressure can build up slowly, without noticeable symptoms, and once the damage is done, it's usually irreversible. That's why early detection is crucial, but most people don't realize they have it until significant damage has occurred. Imagine looking through a tunnel. Early glaucoma is like having a wide view, but as pressure builds, your peripheral vision narrows. This gradual loss of side vision is often the first sign, but many don't notice until it's too late. This is why glaucoma is called the silent thief of sight. For those over 60, the risk is higher. The World Health Organization reports that 3% of people over 60 have glaucoma, and it's the second leading cause of blindness worldwide. With aging, managing glaucoma becomes even more important. Early detection and treatment can prevent severe damage and might help you avoid surgery, preserving your vision. By staying proactive and getting regular eye exams, you can catch glaucoma early and protect your sight for the future. Mistake number 1: ignoring regular eye exams. Many people skip eye exams thinking, "I don't have any vision issues, so why bother?" But glaucoma often develops without noticeable symptoms, and by the time you notice changes, the damage may already be irreversible. Ignoring regular exams is a major mistake. Catching glaucoma early is like fixing a roof leak before it causes major damage. Once the damage is done, it's harder to repair. This is especially important for those over 60, as early glaucoma symptoms can be subtle. The good news is, regular eye exams are crucial for early detection. The American Academy of Ophthalmology recommends starting exams at age 40 or earlier if you're at higher risk. These exams help detect high intraocular pressure IOP, a key risk factor for glaucoma. Early detection can slow or stop the progression of the disease, potentially preventing the need for surgery. If eye exams aren't part of your routine, now's the time to start before it's too late. Mistake number 2: not managing eye pressure, IOP. High intraocular pressure, IOP, is one of the main risk factors for glaucoma. IOP refers to the pressure inside your eyes, and when it builds up, it can damage the optic nerve, which is responsible for transmitting visual information. However, not everyone with high IOP develops glaucoma, and not everyone with glaucoma has high IOP. It's a condition that needs careful management. Think of it like a car tire. If it's overinflated, it could burst. Similarly, too much pressure in your eyes can cause the optic nerve to wear down over time, leading to vision loss. Managing eye pressure is crucial, especially if you're over 60, to prevent glaucoma and avoid surgery. How do you manage IOP? Medications, like eye drops, are typically the first line of defense, but if pressure remains high, laser treatments or surgery might be recommended. According to the Glaucoma Research Foundation, lowering IOP is one of the best ways to treat and prevent glaucoma. So if you've been prescribed treatments, be consistent and don't skip them. Keeping eye pressure low is key. To help you stay on track, set daily reminders for your medication, and follow your doctor's advice closely. Small, consistent actions can make a big difference in protecting your sight. Mistake number 3: neglecting to follow prescribed treatment plans. It's easy to skip medications, especially when you're not feeling any immediate effects. However, with glaucoma, missing doses or stopping treatment can be a costly mistake. Glaucoma doesn't cause pain in its early stages, so many people assume they don't need medication if they don't feel any symptoms. But the damage from glaucoma is often irreversible, and once it progresses, it's hard to fix. A common mistake is stopping prescribed treatments because people think their vision is fine or feel the drops aren't working. In reality, Those treatments are keeping your eye pressure under control and protecting the optic nerve from further damage. Skipping even a few doses can lead to increased pressure, causing further nerve damage and potentially irreversible vision loss. Research shows that 30 to 50% of glaucoma patients don't follow their prescribed treatment plans, which raises the risk of vision loss and often leads to more expensive treatments, including surgery. Consistency is essential to avoid the need for surgery and keep your eyes protected. A simple way to stay on track is by setting medication reminders or using a medication chart. If you're unsure about your treatment, talk to your doctor. It's always better to address concerns early than to risk worsening the condition. Mistake number 4. Not monitoring symptoms closely. Glaucoma's symptoms often develop slowly and sneak up on you. In its early stages, you might not notice anything wrong, but vision loss typically starts with your peripheral vision, what's known as side vision. It's like the edges of your sight blur gradually, and because it happens slowly, you might not realize it until a lot of vision is lost. This is why it's so important to monitor any changes in your vision. Most people don't notice glaucoma symptoms until the damage is noticeable, but there are things you can do to stay ahead. Regular eye exams are key, but keeping track of subtle changes yourself can make a huge difference. For example, if you notice difficulty seeing at night or colors seeming dimmer, it's time to see your doctor. The American Glaucoma Society notes that many early symptoms go unnoticed, which is why it's essential to monitor your vision regularly. Using tools like an Amsler grid at home can help spot changes in your sight early, though it's no substitute for a professional eye exam. Untreated glaucoma can lead to permanent vision loss, and the longer you wait, the harder it is to manage. The good news is, by staying proactive and being aware of any changes, you can catch glaucoma early and prevent further damage. Mistake number 5. Ignoring other health conditions. Glaucoma is closely linked to your overall health, and chronic conditions like diabetes, hypertension, and high cholesterol can increase your risk or worsen glaucoma if you already have it. These conditions affect blood flow to the optic nerve, which is essential for vision. Poor circulation can damage the nerve fibers, making it harder for your eyes to function properly. For example, if you have diabetes, you're at a higher risk for eye problems, including glaucoma. Research shows that diabetes can cause changes in the blood vessels that supply the eyes, affecting the optic nerve. Similarly, high blood pressure can damage the blood vessels in the eyes, raising the risk of glaucoma. It's crucial to keep these conditions under control to protect your eyes. Managing these health conditions is about more than just taking medication, it's about adopting a healthy lifestyle. Regular exercise, a balanced diet, and stress management all help improve overall health and lower the risk of glaucoma. Incorporating foods rich in antioxidants, omega-3 fatty acids, and leafy greens can also support eye health. Regular doctor visits are essential to monitor these conditions and adjust your treatment plan as needed. By managing your overall health, you're not only helping your heart and lungs, you're also protecting your eyes from further damage. Mistake number 6. Smoking and poor nutrition. We all know smoking is bad for our health, but did you know it can also harm your eyes? Smoking reduces blood flow to the optic nerve, which can lead to damage over time. This is especially concerning for those over 60, as age-related changes make the optic nerve more vulnerable. So when you think about quitting for your lungs, remember your vision too. It's a double win. Your diet also plays a crucial role in eye health. Poor nutrition can lead to deficiencies in key vitamins like A, C, and E, which are essential for good vision. The good news is that simple changes to your diet can have a big impact on eye health. A diet rich in antioxidants, omega-3 fatty acids, and vitamins can help protect against eye diseases like glaucoma. Instead of chips, snack on almonds or add salmon to your salad. Both support eye health. Foods like berries, spinach, and kale are packed with antioxidants, while omega-3s from salmon and flax seeds improve blood flow to the eyes, which is vital for preventing glaucoma damage. While quitting smoking and eating better are important steps, they're not a cure-all. It's still important to maintain regular eye exams and follow your treatment plans. However, these changes can go a long way in protecting your vision and reducing your glaucoma risk. Mistake number 7. Not protecting your eyes from injury. Injuries to the eye can actually increase the risk of developing glaucoma or worsen it if you already have the condition. Whether it's a blow to the eye during sports, an accident at home, or even the natural wear and tear that comes with aging, trauma can damage the delicate structures of the eye. If you already have high intraocular pressure (IOP), these injuries can make the situation even worse. An eye injury can cause inflammation, scarring, or increased pressure inside the eye, which can trigger or worsen glaucoma by further damaging the optic nerve. This is especially true for those at higher risk, such as individuals with a family history of glaucoma or previous issues with IOP. Once the optic nerve is damaged, it's often irreversible, making injury prevention crucial. So, what can you do? First, wear protective eyewear during activities like sports, home projects, or biking. A small investment in safety glasses or goggles can go a long way in preventing serious eye injuries. In addition, be mindful of your environment. If you're working with tools or in areas where debris or chemicals could harm your eyes, always use safety glasses. The more proactive you are, the better chance you have of avoiding injuries that could worsen glaucoma. And a bonus tip, if you've had any kind of eye trauma, regular visits to your ophthalmologist are essential. Even if you feel fine, a thorough exam can uncover hidden issues and help prevent glaucoma-related complications. Now that you know the 7 mistakes that could lead to glaucoma surgery, it's time to take control of your eye health. Are you scheduling regular eye exams? Managing your eye pressure? Making small lifestyle changes to protect your vision? These simple actions can make a huge difference in preventing long-term vision loss. Glaucoma doesn't have to be a scary word. By staying proactive, following your treatment plan, and monitoring your health, you can protect your sight for years to come. If you found this video helpful, like, share, and subscribe for more health tips. Don't forget to hit the notification bell so you won't miss our next video, packed with even more ways to live a healthier life. And before you go, check out the next video on your screen to keep learning about how to take charge of your health. You won't regret it.